Patrick's case study by Amanda Senf and Rohan DeCosta. The factors that have contributed to Patrick's respiratory condition are his 40 years of active smoking, his BMI which is considered to be overweight, and his diagnosis of worsening left-sided heart failure and COPD. The effects of tobacco smoke on the respiratory system include irritation of the trachea, larynx, reduced lung function, and breathlessness due to swelling and narrowing of the lungs' airways, and excess mucus in the lungs' passages. This leads to the medical diagnosis of COPD, which is branched into chronic bronchitis and emphysema. Chronic bronchitis defined as an inflammation of the bronchi causing the excessive production of mucus, which in turn blocks the airways, resulting in a regular cough to clear the passage, and fatigue due to low levels of gas exchange. Emphysema, this lung disease causing destruction of the fragile walls and elastic recoil of the fibers of the alveoli, where the small airways collapse when one exhales, impairing airflow out of your lungs, causing a buildup of carbon dioxide and decrease of oxygen saturation. These conditions link to his respiratory symptoms of fatigue due to the increased use of his accessory muscles to compensate for lack of functionality of the lungs. All these respiratory symptoms can be correlated to his BMI and being classed overweight, and he is unable to regularly exercise due to the constant state of fatigue and dyspnea. Further, worsening of his left-sided heart failure is also contributing to his respiratory signs and symptoms, causing tachycardia of 155 beats per minute, as the heart is overcompensating for the lack of oxygen and therefore beating faster to pump blood to provide effective tissue perfusion. Other signs that contribute to his respiratory condition is edema and swelling due to ventilation perfusion, mismatching causing dyspnea, tachycardia, and fatigue. The factors that have contributed to his elevated heart rate at 155 beats per minute are due to the worsening of his left-sided heart failure and COPD. The pathophysiology indicated that damaged lungs do not allow adequate gas exchange, causing the heart to pump more rapidly in order to compensate for the lack of oxygen being delivered throughout the body. This diagram demonstrates the effects that smoking causes on a person's lungs. Toxins from the cigarette smoke over a period of time has caused the respiratory membrane surface area to be reduced. As an active smoker of 40 years, it's increased the risk of heart disease as seen and is also evident of being a casualty of a myocardial infarction. Nicotine inhalation stimulates the release of adrenaline and noradrenaline, and in turn increases cardiac workload and oxygen demand, causing an increased heart rate and peripheral vasoconstriction. Cigarette smoking is also associated with peripheral artery disease, which is evident with an increase in LDL and decrease in HDL, and contributes to damage of the blood vessel endothelial lining, blood vessel inflammation, and atherosclerosis due to fatty deposits. This in turn makes the heart work harder to allow oxygen-rich blood to reach the body tissues, resulting in an increased heart rate. The worsening of a left-sided heart failure and suffering a myocardial infarction negatively impacts the physiology of his left ventricle from efficiently and effectively pumping and supplying oxygen-rich blood to the rest of the body for tissue perfusion. A myocardial infarction occurs when a portion of the heart is deprived of oxygen due to a blockage of a coronary artery. The coronary arteries supply the heart muscles with oxygenated blood. Without oxygen, muscle cells served by the blocked artery begin to die, and in turn results in tachycardia. Pulmonary edema is also a result of left-sided heart failure, which triggers tachycardia to occur, and being overweight increases the chances of hypertension, as evident, causing higher heart rate. COPD and left-sided heart failure have developed independently. However, they are strongly influenced by one another's symptoms. The diagnosis of COPD is due to the years of active smoking. This has developed because the harmful toxins in cigarette smoke has had a detrimental effect on the alveoli, damaging the walls and significantly impairing the effectiveness of gas exchange. This has resulted in an impairment of the airflow in and out of the airways due to the air sacs stiffening, the walls between the air sacs deteriorating, thickening, and becoming inflamed. It has further led to an increase in mucus production, causing significant obstruction and a regular cough in order to clear the passageways. The diagnosis of left-sided heart failure is not a disease but rather a process, as there could be a systolic or diastolic heart failure. When systolic failure occurs, the left ventricle cannot contract forcefully enough to keep blood circulating normally, and when diastolic failure occurs, the left ventricle has grown stiff or thick, and it is unable to fill the lower left chamber of the heart properly, which reduces the amount of blood pumped out of the body. Over time, this causes blood to build up inside the left atrium and then in the lungs, leading to fluid congestion and symptoms of heart failure. It is highly likely that both these conditions may have led to the development of each other. However, it is more likely caused by genetic disposition, gender, age, active smoking, a myocardial infarction due to blockages of the coronary artery, and long-term high blood pressure caused by sedentary and inactive lifestyle. Further, by Patrick being diagnosed with COPD, it has increased the risk of a number of complications, including heart failure, where the heart has to work extremely hard to pump blood through the damaged lungs. Right-sided heart failure, which often occurs due to left-sided heart failure, is due to the weakened and/or stiff left ventricle losing power to efficiently pump blood to the rest of the body. As a result, fluid is forced back through the lungs, weakening the heart's right side, causing right-sided heart failure. This backward flow backs up into the veins, causing fluid to swell in the legs, ankles, gastrointestinal tract, and liver. It is also evident that lung disease like COPD or pulmonary fibrosis can cause right-sided heart failure, despite the left side of the heart functioning normally. For Patrick, who has worsening of his left-sided heart failure and being diagnosed with COPD, he is at definite risk of developing right-sided heart failure. The reason for this is that the left side is not effectively pumping oxygen-rich blood out of the left ventricle efficiently. This prevents the body from getting enough oxygen-rich blood. The blood backs up into the lungs, weakening the heart's right side, causing right-sided heart failure. This backward flow backs up in the veins, causing fluid to swell in the legs and ankles. Patrick's blood test results show that he currently has a high level of sodium. This is known as hyponatremia. This could be in result to salt and fluid retention by the kidneys caused as a result of reduced blood flow to the kidneys, which ultimately leads to the secretion of aldosterone, a hormone that stimulates absorption of sodium. Sodium is an important electrolyte and essential for the functioning of all cells. Nerve cells are particularly sensitive to the amount of sodium in the blood because they need electrolytes to function properly. Too much or too little sodium can cause problems with the nerves in your brain and elsewhere in your body, showing clinical symptoms, disruption of the natural electrical current of your nerves. Hyponatremia can cause swelling in the hands and legs due to edema, along with tachycardia and neurological dysfunction due to electrolyte imbalance affecting the neurons in the brain, which can lead to lethargy and irritability. Potassium is slightly high and is known as hyperkalemia. When it comes to the nerves, this can affect how quickly your reflexes respond, or even how well the sensory nerve endings work. Nerves in turn can then stimulate muscle fibers, cardiac muscles, skeletal muscle, or smooth muscle to contract, which can affect action potentials of muscle functionality. When blood levels of potassium are too high, contraction of the heart may not be forceful enough to pump blood out of the heart, as is in the case with Patrick. The decrease in calcium could be due to renal failure or hyperparathyroidism. Decreased calcium levels in the blood also show that there is in turn a decrease in myocardial contraction. Low blood calcium levels can impact the nervous system, including causing mental confusion, memory loss, hallucination and delusion, as well as depression. The blood test results indicate high level of low-density lipoproteins and low levels of high-density lipoproteins and high levels of triglycerides. This increases the risk of heart disease. This is because a high level of LDL and triglycerides can lead to the buildup of cholesterol in the arteries. Along with other substances, it forms plaque. The plaque then builds up in the arteries, creating a condition called atherosclerosis and in turn leading to stroke, heart attack, or even heart failure, as it is in the case with Patrick. The hemoglobin count is also low. This impacts on blood perfusion and oxygen reaching needed cells. This can lead to anemia. This is clinically presented with some shortness of breath, tightness of the chest, and fatigue. This could indicate evidence of chronic or severe kidney disease leading to the reduction of erythropoietin, a hormone secreted by the kidneys to stimulate the production of red blood cells in bone marrow. The anemia itself can worsen cardiac function, both because it causes cardiac stress through tachycardia and increased stroke volume, and because it can cause a reduced renal blood flow and fluid retention, adding further stress to the heart. Glucose is precious fuel for all the cells in the body. High levels can have significant impact, as in the current blood results. It slowly erodes the ability of cells in the pancreas to make insulin. The organ then overcompensates and insulin levels stay too high. Over time, the pancreas becomes permanently damaged. These damaged blood vessels cause further problems such as kidney disease, heart attack, nerve damage called neuropathy, as well as high risk of developing deep vein thrombosis. A blood test result that is not present and that would show abnormal results in Patrick's case would be the brain natriuretic peptide test. BNP is a hormone secreted by the cardiomyocytes in the heart ventricles in response to stretching caused by increased ventricular blood volume. BNP test results are generally higher in patients with heart failure than in people with normal heart function. However, levels go up when heart failure develops or gets worse, and levels go down when heart failure is stable. It can be concluded in Patrick's case he would show a high level of BNP due to the existing condition of left-sided heart failure, but it would be elevated as it is worsening.